nurse was teaching a client about procedure-informed consent and which element must be included. Which item indicate correct understanding of the teaching? Select all that apply. Alternative procedure, yes, you need to tell the patient that there's another procedure that can save their life. Risks and benefit of what you're going to do. What is the indication of the surgery you're going to do? You have to describe to them in medical terms. No, they are not medical folks, layman terms. So this is not included. Okay. Expected outcome. Yeah, what is going to happen when I let you cut me? Okay, so 1, 2, 3, 5 are your right answer. You don't need to discuss it in medical terms. Simple, so that they can understand. We don't want medical jargons. Like I said, I'm trying to make it straightforward as much as possible. So I put them together in such a way that it's going to be acceptable to you. Things that are familiar before the hard ones. But there's keywords you have to pay attention to. Of course, this is required for any procedure. If you don't do that, you commit some violation. Okay, it's a total violation. If you don't do that, then that is battery. You touch the patient with their permission. So this is why we obtain informed consent, to avoid battery, right? What is the problem? The whole thing is on the surgeon. What does the surgeon need to do? Explain risks and benefit of the procedure, right? What does he need to do? Provide some alternatives for the patient. Need to let me know the outcome of the procedure you're going to do, the complication of that specific procedure, the surgical procedure, the detail in layman's terms, so that I can understand what is going to happen. The indication. Why are you doing this? Well, you have colon cancer, so I need to take your colon right away. This is what is going to, the benefit you're going to get. You don't die from it. All those things is very, very important. What need to happen? Client. Condition. What need to happen? You have to be competent. Not under any influence. Key. So you are not, have no alcohol on board, no drugs on board. What I mean drug is like sedatives. You're not taking anything. So all those things has to be narcotic. And it should not be coerced. Like, you can force me to do that. We got to meet all those standards. It should be voluntary from the patient. The client must understand what you're saying. Once again, in layman language, not jargons. I don't want jargons. We're going to do cholecystectomy. We're going to put the laparoscopy, remove the gallbladder through infantile incision, excise the costal margin. Who cares? Those are gibberish for the patient. I put the camera in, I see the gallbladder, I remove it. They don't need to know all these scientific words. They don't need. So if you see a question like that, all the jargons, no, take them. I don't pick that answer. It's a violation. Keywords. Client can rescind this consent anytime. Even 2 seconds before you get the patient to the operating room, they can rescind. He said, I don't want this. Let me go away. You should let them go away. Otherwise, he committed what? Battery, like I said. What is your role? You, the nurse. Nurse role. This is what's the problem. They like asking you. What is your role? You don't have to do anything. Witness the consent. You are not liable to anything. The consent, your witness, your signature, means what? Patient understand the risks and benefit and has no any other question. They understand what they signing. That's all. It does not mean that you signing, it means you telling them to have surgery. No, you're witnessing the fact that they understand the risks and benefit. They don't have any more questions for the doctor. They don't have any more questions. They're competent. You verify. That's what your signature means. That's all. Signature means they understand the risks and benefit. They have no more question. Patient is competent and he was not coerced. Let me put it there. And it's not under any influence of anything. Influence of drug, narcotic, basically, or sedative, or alcohol, basically. So those are the keys that you got to put it together. There's way they can trap you. If they ask you a question specific to the surgery, well, call the surgeon or the procedure, right? Call the surgeon, whoever is going to perform the procedure. If they ask you something about general knowledge, yeah, something about patient care, oh, yes, provide the usual nursing teaching, pre-op, post-op, and intra-op questions. Yeah, that's basically general, okay? But you know the teaching, what will be there, nurses, but you're not going to tell them how they're going to do the procedure specific to the surgery. Yeah, if they ask you what diet they're going to eat, and yeah, you can't say call the surgeon. No, you should know that. Post-op, these are simple. It's not related to the surgery. It's outside the surgery. So don't say, I don't know. You should go talk to the doctor. Specific to the surgery. That is the key. So I would like to separate it. Situation that the patient cannot sign. Okay, patient can't sign consent. It's when they, like I said, under influence. Try to, I want to say it multiple times so that you can stick. Okay, they are incompetent. They can't do that. Yeah, they can't do that. Or they are unconscious. Who can sign for them? Their power of attorney, ECA, proxy, if they are available. So those are the situations they can sign. Surrogate, anybody, they can sign if they are available, if you can reach them. Okay? These also can come out. You cannot modify the consent after signature. So can't modify after signature. If you need to say after the patient sign, if you need to change anything, so if this is the patient, if this is a word, maybe you said cholecystectomy, and you want to cancel this, you can't do this like that. All you need to do, cholecystectomy, just draw a line in, write whatever you want to write on top so that everybody will know. That is what we mean by modification. Any changes, you draw a line through it so that everybody can see what is under. And so that in the future, we know you never hide and scribble things. Another key fact, cannot what? Obtain consent after the procedure. You go back to normal one. If you do that, you committed what? Battery. You touch them without their consent. So you cannot do that. In few situations, people can sign for another client, like I mentioned. Sign for the client if they cannot do that. So parent of a minor can sign for the minor. Okay, legal guardian can sign consent for their guardian. If you are court appointed, you can also sign. If you're a client, power of attorney, client, power of attorney, yeah, you can sign. Or the proxy, yeah, you can sign. If nobody, yeah, then it's closest relative or spouse can do that. But these people have more priority than the last person legally. There is some exception in terms of consent. They always bring it. So exception to consent. Emergency care. If you come in, anybody who need emergency care, if treatment can be delayed, then the patient can die, yeah, we have to make certain changes. Okay. In emergency care, if there's nobody who is available, and then we have to operate really fast, we have something we call implied consent. So if you come in with the subarachnoid hemorrhage, severe headache, epidural hematoma, that if we, or maybe aortic AA rupture, and you comatose, and we can get a consent from you, the doctor will take you to surgery without a consent. This is what we call implied consent. That means they do it in your best interest. They know if you are available and you are awake, you are not comatose, you will let me operate on you. That is what it means, implied consent. So this patient, in terms of emergency, and the patient is not available to consent, and it's a bad, look at the thing. They are bad injury, not just a single, just a fracture in your leg. Yeah, we can wait and find somebody. This one, time is our essence. If we don't operate on you, you are in trouble. So that one, they can go to surgery without consent. Emancipated, okay, minor. What does that mean? If you're less than 18 years old by state law, okay, and you married, you good, you sign for yourself. If you're serving in the military, yeah, if you have to go and you can get killed, yeah, then you can sign consent for yourself. You married less than 18, you are in the military, okay, and you are a parent less than 18, right? You are financially independent from your parent, you are good. You can sign consent for yourself. Less than 18, you married, military, parent, you are baby, financially independent, you can sign for consent for yourself. Specific, you see, I'm breaking it down. Specific situation too. If you need sexually transmitted infection treatment, yeah, you can sign consent. You don't need your parent consent. If you're looking for contraception and you are less than 18, you don't need your parent consent. If you have a you need mental health treatment, you don't need your parent consent, and you are less than 18, all of them. If it's a substance abuse treatment, you are less than 18, you don't need your parent consent. That's how the group. Another key fact, I'll put a star there. Parents cannot refuse care, life-saving care for their kids. Jehovah's Witness parents said, don't give blood to my son who need blood, and if you don't get blood, he's going to die. We will say no, negative. Okay, negative to that, daddy. We're going to call the ethics Okay, people from the hospital, they will go and get a court order, get a protective custody, for somebody to take care of the kid, and then we will treat the patient. We don't want the kid to die because you said you're a jailwork witness and you don't want blood. No. So that one, if patient need appendicitis, if you don't do it, they're going to die. And the parent said, no, I don't want it. Yeah, we call and we go through this process so that we can take care of it. Otherwise, the kid die. Your parent cannot make that decision. It's a life and death problem. You don't want them to do that. This is the interesting one. Competent adult. These people have all the rights they can have. They're not drugged, they're not intoxicated, they can make a decision, they can have heart attack, MI. They can have triple A rupture. They can have subarachnoid hemorrhage. They can have what? Gunshot wound to the belly, GSW. If they said, leave me alone, I'm leaving, refusing treatment, please let them leave. Otherwise, forced imprisonment. So let them leave. They are competent, they have bad injury, they sound normal. Let them go because according to the law, they can make a decision. They are not under the influence of anything. So they can decide to leave against medical advice. And this is leaded to what? AMA. Basically, so that is the way it goes, the flow. They can leave wherever they live. So, what is AMA? You can make this decision to be able to satisfy for this. You have to be competent. What else? You have no legal, that means there's no legal problem against you that will prevent you. We put you in the hospital because we asked the judge to bring you to the hospital. But if you don't have that situation, yeah. And then you are not suicidal. You're not going to kill yourself. You're not going to kill somebody. Homicidal. You're not going to kill somebody. And can take care of yourself. So self-care. All these conditions, these people, they can leave AMA. Self-care. They don't kill anybody. They are not homicidal. They are not suicidal. They have no legal oath. And they're competent. Competent. They can do whatever they want to do. What should you do? Educate them about what is going to happen when they leave. Or you can say educate them about why they should stay. I think you should stay because you have severe problem. You're going to die on the street. I don't want you to die. So educate them about it. And so what are your actions? Next actions for somebody who want to leave AMA. Number one, assess their competency. Make sure they're competent. So how do you do that? Neuro checks, simple neuro checks. Where you are, what is the problem, what is your name? If they can give you, you've done good neuro check, it doesn't have to be expensive, but simple one, yeah, you've cleared them of the problem, right? Then you know they're competent. Then you discuss with them about the risks of refusal. There is informed consent, then there is informed refusal. So informed refusal, let them know about it. Informed refusal. So you tell them the risks of leaving. When you're going to have surgery, we do the risks of getting the surgery, and the complication of it. Same thing, the risks of leaving, this is what will happen. Give it to them. If still they say no, notify your doctor. Okay, let the doctor know that this is what is happening so that they are aware about it. Okay, let the doctor know. If they say no, then let them sign the AMA form. Give it to them and sign. They may refuse. They will refuse. Don't block the door. That if you don't sign, you're not going to leave. That's imprisonment still. They want to leave. I know they need to sign the AMA, but they can still refuse to sign it. Don't block the door. If you block the door, it's forced imprisonment. All you need to do, say, fine, you can leave. Just make sure you remove all IV or tubes from the patient. Don't call the security, don't call them. And just document in the chat. About refusal to sign the AMA form. That's all. You've done your job. That is all you need. You've done your job. There's some situation where we have to keep these patients. Well, that's what we call involuntary admission. I briefly said it. I said it, but I just want to put it under this involuntary admission in case you see that you will not get confused. These people are admitted due to self-harm. They want to harm themselves. They're trying to commit suicide or harm somebody else. So homicidal or lack of self-care, like schizophrenic patient, catatonic symptoms, they can't do anything. So you have to keep them. We have to admit them to the hospital and then take care of them. The key is this: despite involuntary admission, they still have all the rights afforded them. Every right they have not lose it. So don't go and put IV in right away. Don't go and do things you're not supposed to do. If you go and put the IV in, they say no, and you force them, you commit battery. So they still have the right of refusal. So they can refuse, it's different, refuse treatment. So I've been admitted, but still refuse treatment. They can do that. You cannot restrain them. You can't. You can't put them in seclusion. No. You can't do that. They still have all the rights. If they have a mail coming, you can't open it. If they have food from somewhere, can't throw it away. Because you worry there may be some drugs in it. Give them all the necessary information that they need. You still treat them like normal person. If you need to give them medication and they're refusing, you go back to the court and get an order from the court, and then you can do other stuff from it. But that is the key. You don't do anything that is not like, hey, they are involuntary admission, so you just want to like treat them like somebody else. You can't do that. And this is informed consent, detailed information that you need to know about this process. Okay.